All right, guys, today we're going to do PowerPoint number 5, positioning the patient. So before you put a patient in any position, make sure they don't hurt themselves. Safety is always number one. So make sure they don't fall, help them onto and off of, make sure they don't roll off of it during it. You want to make sure that you protect their privacy. Privacy is always huge. Don't get them completely naked if all you need to do is look at their foot or neck or something. That's rude. Also, it's invasion of privacy. And then remember, we've already talked about during the exam, safety, number one, and then also comfort. So you need to reassure them, always be watching them, make sure they're not freaking out. You need to be there for the patient. This is not the time to be running and getting things or doing stuff. You are there to stare at and observe the safety and comfort level of the patient. And then after they leave, then you need to clean everything, disinfect everything, blah, blah, blah. So we're going to go through the different positions that you put patients in based on what you're doing to them or what their main complaint is. So the first one is sitting. I don't know what to tell you guys. It's sitting. The next one is called, usually we call it supine in the real world. This curriculum likes to call it horizontal recumbent. It's laying down flat. So they lay on their back, their legs are extended out. Arms are either down by their side, or sometimes they'll kind of almost like what you're doing when you do a sit-up. They'll put their hands behind their head or their neck just for comfort level. This is best when you need to get to the front side of their body. So usually for normal examinations, we start with them sitting like the last position while we're listening to their chest and listening to lungs and heart and looking in ears and nose and mouth and things like that. And then we'll have them lay down flat. And generally the laying down flat part is to assess the abdomen, especially. So we'll palpate, meaning touch, feel on the abdominal region, all 4 quadrants, to make sure that everything is nice and soft and not enlarged. The next position is the opposite of supine. It's prone. So prone is belly down. So usually I have to turn a head to one side or the other. If you're getting a massage, sometimes they'll have the fancy tables where the head's cut out and you can put your head down flat, but usually with one head to the side. This is so that you can get to their back. So skin checks on the back, any sort of thing where we need to get to the back of the thigh, anything like that. Right part of the body. Next comes SIMS. So this is frequently called SIMS. A lot of times it is also called left lateral, and sometimes it's called recovery position. Recovery position because if you've ever heard, if someone has a seizure, once the seizure is done, before they're completely back and out of it and with it again, you put them on their left side. Same for if you're doing CPR on someone and their heart starts back up, you put them on their left side. It's so that they're not laying down flat on their back and then puke and then breathe it in and choke on it. We put them on their left side. Anatomy-wise, the shape of the bronchi, the air tubes, it's best to have them on their left side and on their side, period, because then the puke comes out instead of getting breathed back in. So if you see they're on their left side, their left leg is flat, their left arm is behind them, and then their right arm and right leg are kind of used like kickstands. So you put that right arm in front of them, kind of bent to hold them up so they don't fall down on their stomach, and you put that right leg bent and up in front of them so that they don't just roll down onto their stomach. This is the recovery position, which they failed to mention, but also a big thing to know is that this is the best position to get a rectal temperature. So remember, anytime they're severely hypothermic, we want that core body temp, and the best way to get that is a rectal temperature. You do not just put someone prone on their belly to get a rectal temp, because then you get a lot of resistance from the gluteus maximus. If you put them in a SIMS position like this, it kind of spreads that gluteus maximus for you, so you don't have to fight as much resistance to get the rectal thermometer in. It also props that right hip up in case you specifically need to assess something in the right hip. Fowlers. Okay, so you have high Fowlers, which is up at a 90-degree angle, like they're sitting up straight. You have semi-Fowlers, which is like a 45-degree angle, and then you have something called low Fowlers, which is like 25 to 30 degrees. So this would probably be semi-Fowlers. This is about a 45-degree angle that this girl is at. Maybe a little bit lower than semi, but that's fine. So why would we use this? specifically for breathing problems and a lot of times drainage issues as well. So if you've ever had like a super stuffed up nose and you can't really breathe when you're laying down flat, but when you prop up on a few pillows, it kind of helps that drainage a little bit. And so then you can breathe. Well, same thing with this. Although a lot of times when people are experiencing orthopnea, which is that difficulty breathing when you're laying flat, it's more severe than just a sinus infection. For instance, heart failure patients, when their blood leaks into their lungs and then they start drowning on their own blood. When they sit up some, it helps that clear out a little bit. So for those patients, especially orthopnea patients, you want high Fowlers. Now drainage, it depends on the type of drainage. So if it's like sinus drainage, then yeah, any of the Fowlers that's comfortable for them is fine. However, if you're bleeding in your mouth, you do not want to lean back a whole lot. You really want those patients in high Fowlers because when they lean lower than that 90-degree angle, they start to swallow some of that blood. And then it can upset the stomach and cause them to vomit up that blood. Same thing for nosebleeds. Epistaxis is the fancy word for a nosebleed. You want to have those people in high Fowlers and pinch their nose. And you can even have them kind of look down a little bit. So sitting straight up, high Fowlers, but pinching the nose and looking down a little bit. It helps the lower ones, especially like semi-Fowlers, the 45-degree angle. When we want to assess the neck, there's a lot of different reasons we look at the neck. We're assessing the trachea. JVD, jugular vein distension. So in certain types of heart problems and chest problems, you can see their jugular veins filled up with blood, and that's always bad. And we generally want to assess that in semi-Fowlers. But for the breathing one and the drainage one, you want high Fowlers. Lithotomy. Lithotomy is the giving birth position. That's the best way that I can explain it to you. So they lay on their back, their knees are bent with their feet up to them, and their feet are wide-ish. So I always had a doctor tell me you can never be too far down on the bed and your knees can never be too far apart when you're doing a lithotomy position. So their knees fall wide, they fall away from each other. This is for vaginal exams and for vaginal births. So pap smears are done in this, any sort of female urinary exam or procedures done in this, and then pelvic surgeries as well. Trendelenburg. Trendelenburg is when the head is lower than the feet. So generally, you can kind of fake this on the ground by propping the feet up, but in a real hospital bed, it's a button or a lever that you push and it puts them into Trendelenburg, which lowers their head significantly lower than their feet. I'm not talking about like hanging upside down like a bat. That's not what I'm saying. You know that. But it's a fairly significant degree. We used to do this when people were having shock or hypotension, when their blood pressure was real low and they were getting dizzy and stuff. A lot of times for shock and hypotension now, we just put them flat. So supine, that laying on your back, that's what we want because then the blood stops having to fight gravity to get up to the brain. The reason that we're trying to kind of get away from Trendelenburg is you have these things called baroreceptors, or these special little cells, a couple different places, but one of them is in your carotid arteries that picks up on your blood pressure. And so when your blood pressure is low, your body does things to fix it, right? It tries to overcome that and to keep pumping blood. But when you put people in Trendelenburg, their carotid arteries, the baroreceptors in there, don't think there's a problem because they're getting plenty of blood. So it doesn't tell the brain, hey, there's a problem, we need to try to fix this. It tells the brain, all right, we're cool. And so it kind of actually hurts a lot of times because then your body's not trying to fight the low blood pressure like it should be. All right, this is the first slide. Repeat again. So that's it for patient positions. All right, guys, I miss y'all. Bye.